Hi, my name is David and I'm a registered nurse here at God PPEC. Welcome to our education series. I'll be covering an important topic, a nursing skill, which is administering medication to a child via the gastrostomy tube. Medication administration can be a challenging experience, especially when caring for children who require special considerations. Let's walk through the steps to ensure safety, effectiveness, and comfort for our young patients. Before administering medication, it's essential to gather the necessary supplies you will need. So this is the attachment for the child. Water for flushing. The syringes to drop the medication and to push them. The child medication. And gloves. Also, hand sanitizer for before and after. Checking the medication. Always verify the medication against the child's prescription and medication administration report, also known as a MAR. You always want to check for 1, the child's name, 2, the right medication, 3, the correct dose, and 4, the administration route, demonstrating the procedures. Now, let's prepare the medication. If it's a tablet, we need to crush it and mix it with a small amount of water. For liquid medication, we can measure them directly into the syringe. Positioning the child. Positioning is key. Ensure the child is sitting up or at least at a 30-degree angle to prevent aspiration. Always explain what you're doing to both the child and their caregiver for comfort and understanding. Administering the medication. Now we're ready to administer the medication. Gradually push the medication into the tube, ensuring there are no kinks or blockage. After administering the medication, it's important to flush the tube with water to ensure all the medications is delivered and to keep the tube clear. Use about 5 to 10 ml of water for flushing. Monitoring the child. Finally, monitor the child for any reactions or side effects. It's crucial to observe for nausea, vomiting, and any discomfort after administration. Always document the medication given and any observations made. Administering medication via gastrostomy tube requires careful attention and practice. Always prioritize the child comfort and safety. Thank you for watching, and be sure to check out our other videos on nursing education.